I'm back with our good friend, ophthalmologist, Dr. Kerry Assil. Welcome back, Dr. Assil.
Thank you, Travis.
And also joining us is Gabrielle, who has a question that Dr. Assil is here to help answer. So what's going on?
So I keep getting recurring blood vessels that break in my eye, and it basically looks like I have a pool of blood in the bottom of my eye, as you can see from that nasty picture up there. And I'm a pole dancing instructor, and so I heard that maybe it could be from me going upside down all the time, and when it goes away, it still leaves red spots in my eye. So I just wanted to find out what I can do about getting rid of those spots, if there's some sort of medicine or surgery that I can do to get rid of the
Well, one of the first things we'll always ask, and Dr. Assil is going to address the specific situation with your eyes, but do you ever have any issues bleeding anywhere else? Do you have any other medical problems?
Nope.
And how often does this happen?
It's happened most recently a few months ago.
And right now, it looks like it's resolving in your right eye a little bit. Mm-hmm. When this happens, these, what we call subconjunctival hemorrhages, they are glaring when you look in the mirror and scary.
Yes.
Yeah, you know, when we get a bruise anywhere else in the body, we don't think much of it. But on the eyes, against that white background, and because it's the eye, it can be very scary. Mm-hmm. So this is a very common reason why patients come to the doctor's office for a visit. We like to break it into little categories as to what could be causing it. One category is congestion. Congestion could be anything from high blood pressure causing backup, or congestion of the blood vessels in your sinuses from allergies, for example, or heavy lifting. Certainly in the case of turning upside down, that's more than just heavy lifting. Another category to think of is trauma. Trauma is, you know, we think of getting hit in the eye with a baseball, but no, even eye rubbing, or at night when we sleep, the pillow can rub on the eye, so you can wake up that way. And then, as Travis pointed out on the front end, blood thinners. People that are on aspirin, even baby aspirin, maybe vitamin E if it thins the blood a little bit, and so forth. So we like to first go through all those things before we start considering actual treatments.
Okay.
Just to have a little look, I'll follow my finger here. So what we see on the front of her eye is not just only an area of redness, but also a little patch of discoloration. Raise your chin up just a little bit and follow my eye here. That patch of discoloration is probably not from bleeding, actually. That particular patch is just a pigment. It's almost like a little freckle or a birthmark that could be addressed differently. People ask about surgery for the redness. I find that surgery is a very bad option, these eye whitening procedures. On more than one occasion, I've had a patient who had an eye whitening procedure, was sent to me for complications, where because the blood vessels that are bringing nutrients were all gone, the surface of the eye was actually melting. In one case, there was a full thickness hole into the eye, and I had to do emergency patching with a scleral patch just to prevent the patient from losing their eye.
Oh, my God.
So eye whitening surgery and so forth is not such a good idea. It's better to get after the root cause, which is often just a dry eye or allergies or inflammation on the surface of the eye, which a good eye examination can reveal. And if you're desperate and say you're in the public's eye, you're going to be on camera, or you're making a big speech and the eye has to be white, there's eye drops we have. There's an eye drop called Alpha-Gan that we normally use for glaucoma treatment that'll blanch all the vessels for a number of hours if you have to have some relief in short order. But surgery for this is typically not recommended.
And the good news, for most people who get these occasionally, whether it's you're coughing, you're pole dancing, you know, anything that you mentioned can increase pressure. For the most part, assuming there's no underlying condition, it's benign, right? It just takes a while for it to resolve.
It's benign, and if you notice it right away, you could put a little ice pack over the eyelid. You can't pressurize the eye like you do other parts of the body, because it'll cut off the blood flow to the eye. That could be much worse than anything. So you don't want to put a lot of pressure on the eye, but you could put a little ice on there to keep it from expanding and get those vessels to compress.
Gabrielle, thanks for asking your question. Dr. Assil, always a pleasure.